with regards to the COLA of 2.5%, that, according to my notes, accounts for about $138.8 million in increase. Is that accurate?
For
the COLA. What's the cost of the COLA?
Yes. Yeah.
Okay.
Yes. But across different agencies.
Yeah.
Yes.
And is that 138 million for both state facilities and the non-state facilities?
No, the COLA is not for state facilities.
It's just for?
Community-based services.
It's just for community-based organizations. Okay. And that's a 2.5% increase from the prior year, which was 5.4%?
Yes.
The prior year. Now, these direct care providers in these facilities are barely making more than minimum wage. These facilities struggle to raise wages to make the jobs more competitive. The minimum wage was raised from 21 to 2022 by 5.6%, and the state implemented a 5.4% budget increase for that last year. The minimum wage increase upstate this year from 22 to 23 is a 7.6% increase, and only a 2.5% increase for these facilities. How are they supposed to keep pace in recruitment and retention of employees when a fast food worker is getting 3 times the raise?
You know, I think, as we've said, as has been said before, the COLA is 2 years now. It's 5.4% and 2.5%. It is definitely helpful. Also, there are other ways that all of our providers get dollars, and that's through rate increases, which have been significant. As I mentioned before, rate increases of up to 27% for hospitals, 10% for clinics, 25% for our residential treatment facilities, lots of money going into housing. So there are other ways that dollars come in. The other issue is recruitment, the kinds of things I've talked about, and Commissioner Neifeld, we need to recruit people, get them interested in the human services service, and we were working with universities around that. We also have loan forgiveness programs, and we also have scholarships that we give to minority groups to come in, to get educated, to come into the field. So there's a number of things going on for workforce.
The basic wage isn't helping any, this increase. We're losing ground to fast food workers.
Just for a point of clarification, for the OPWDD budget, and I believe for OASIS and OMH, that there are additional dollars invested to keep pace with minimum wage. So the minimum wage increases that you talked about in downstate and upstate, there are additional dollars invested in all of our budgets. So those keeping pace with minimum wage does not need to come out of the COLA investment. Just wanted to clarify that point.
How much is that?
For my budget, I'd have to get back to you on exactly what that figure is, but it is there in our budget, and I can't speak for the other agencies. But.
Well, it just seems to me to be an insignificant increase compared to the raise in the minimum wage this year. Now, if I want to turn to the investment in mental health beds, 1,000 beds, and I think that's great. I think the ratio of those beds of state facilities to private facilities is inversely applied. Why are we putting money in for so few state facility beds when Governor Cuomo closed 3 or 4 times that number of beds during his reign of terror on the mental health institutions in this state? Yet we're not reopening these beds that are there vacant and available. And frankly, the institution of pushing these mental health patients to non-governmental entities has been an abject failure. Yet you're going to create 850 beds more there and only 150 in the state facility. Why is that?
The community beds, there are about 6,000 community beds in New York State. The 850 beds were the ones that were closed during the pandemic. Prior to the pandemic, the occupancy in those hospitals was about 70%, which means that there was not a shortage of beds. When you look at the state system prior to the pandemic, similarly, we were probably at about 90% occupancy, but we did not have any significant waiting lists. post the pandemic and the closure of those beds is when we've hit this incredible shortage. We do think there's about 150 more beds needed in the state system, and that seems like that would right-size the system and provide the right kind of care.
Thank you. I disagree.